Hello, everybody. This is Nurse Eunice with Florida Training Academy. And in this morning's video, we're going to be reviewing the Patient Care Technician Practice Examination. And for those of you who are unaware, a CNA with more training, a CNA who works in a hospital, the ones who may be drawing your blood in the hospital setting, we call those techs or patient care technicians. So yes, as a CNA, you can do more with your license. You can work in the hospitals, you can work in ICUs, but you have to get more training. And so if you're interested in becoming a patient care technician, hopefully this video will assist you. All right, so everybody, Florida Training Academy also has a sister company called Florida Career Academy, and that's our online academy because we train locally in our office in Jacksonville. We do the hands-on CNA classes, but we have students abroad. We have students all throughout the nation. And so if you're interested in becoming certified as a patient care tech online, flexible schedule, and it's affordable, learn EKG, learn phlebotomy, you can do so by going to floridacareeracademy.com and then just requesting more information by entering your contact information in the contact form. All right, so number one, which of the following vital signs is considered normal for an adult? A blood pressure of 150/90 millimeters of mercury. B, heart rate of 110 beats per minute. C, respiratory rate of 28 breaths per minute. Or D, temperature of 98.6. And today I will not be looking in the comments. So if you are commenting your answers, I'll have to check them after the live stream. If you chose D, you are correct. The normal adult temperature is 98.6. However, we like to give some fluctuations. So we'll say anything from high 97s to high 99s is normal. But don't forget that with your elderly population, anytime their temperature goes 2 degrees above their baseline, so if the baseline is 98, if they get to 100, we consider that they may have a fever that's caused by an infectious process. So 2 degrees above baseline for an elderly person is a fever. Let's go to question number 2. What is the correct procedure for measuring blood pressure? A, inflate the cuff to 150 millimeters of mercury. B, place the stethoscope on the brachial artery. C, deflate the cuff slowly while listening for sounds. Or D, record the diastolic pressure when the sound disappears. What do you think? If you've never taken a manual pressure before, I do have a video on manual pressures. I'll make sure I add that in the comment area. I'm revealing the answer in 3, 2, and 1. And the answer for number 2 is C. So great job, the rationale. Whenever you're having your stethoscope and you're using the manual blood pressure, the blood pressure is measured by slowly deflating the cuff while listening for sounds. And those thumps you hear, the thump, 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 that has a name. It's called the cortical sounds. And that's what you're listening for. The first sound you hear, that's rhythmic, we consider that the systolic. And then the last thump you hear would be the diastolic blood pressure. Question number 3. Which of the following is a sign of hypoglycemia? A, bradycardia. B, hyperglycemia. C, excessive thirst. Or D, diaphoresis. Hypoglycemia. Hypo, prefix means lower than normal. Suffix glycemia, blood sugar, or the sugar level within the blood. So which of the following is a sign of a low blood sugar? And if you chose D, diaphoresis, or excessive sweating, you are correct. They get hot, they start sweating, and sometimes they can even become really hard to arouse. All of those would be signs of somebody who might be having a hypoglycemic episode, which is a medical emergency. Please notify your nurse and don't try to put anything in their mouth if they are not able to speak or swallow. Question number 4. Which technique is used for a patient who is unconscious and not breathing? A, CPR, B, Heimlich maneuver, C, recovery position, or D, applying a tourniquet? Well, I know you all are super smart, so you know it's not D. If they are unconscious and not breathing, you don't even have to check for a pulse. If a person is not breathing, you are to assume they are dead. And you're going to start CPR, or cardiopulmonary resuscitation. Question number 5. What is the purpose of sterile technique in healthcare? Is it A, to prevent contamination of wounds, B, to clean the patient's skin, C, to reduce the spread of infectious diseases, or D, to administer medication safely? What is the purpose of sterile technique? And yes, you are correct. It is A. Sterile technique is used to prevent contamination of wounds and invasive procedures. So, as a CNA, you cannot perform sterile technique. However, this test is geared towards patient care techs, and the patient care techs are taught more skills. They're taught sterile gloving. They are also sometimes taught to insert catheters. So, they wouldn't want to introduce any germs into someone's urethra or urinary tract, which is why they would use sterile technique whenever they are performing or inserting a catheter. Number 6, which of the following is a symptom of urinary tract infection or UTI? A, hematuria, B, dyspnea, C, polyuria, or D, epistaxis? All right, so let's go through these prefixes. Hema means blood, urea, urine, dys, is pain, nia is breathing, poly is an increased amount, and urea is urine. So the first one is blood in the urine would be A, B would be shortness of breath, C would be excessive urine, and then D, epistaxis, is like a nosebleed. So which of the following is a common sign of a UTI? And it's not A, it is C, polyuria. Usually whenever someone has a urinary tract infection, initially it may be some irritation and they keep having to go to the bathroom frequently. It's only when they have more of an infection, that's when you may start seeing urine in the blood, but that's usually late stage. So initially you'll notice your patients going to the bathroom more frequently. Question number 7. What is the first step in performing venipuncture? Venipuncture is phlebotomy, drawing blood, which a patient care tech can do. Is it A, clean the site with alcohol, B, apply a tourniquet, C, select the appropriate needle gauge, or D, identify the patient? What is the first step in performing venipuncture? And oh, I wish I can see the comments right now because I know you're getting this one right. And the correct answer is D. It doesn't matter what you're doing. The first step is to make sure you're doing it to the right patient. So you want to make sure that you always identify the patient. That's your first step. Question number 8. How often should a patient be turned to prevent pressure ulcers? Is it A, every 2 hours, B, every 4, C, every 6, or D, once a day? Yeah, that was too easy. And you all are correct. It is A. Patients should be turned every 2 hours to prevent bed sores or pressure ulcers, and more frequently if they complain of any pain, discomfort, try to turn them so that we can, prevent those ulcers from forming. Number 9, which of the following is a symptom of shock? A, hypertension, B, bradycardia, C, tachypnea, or D, flushed skin? You should be familiar with hypertension. Bradycardia is a slow heart rate. Tachypnea is fast breathing or flushed skin. I'm revealing the answer in 3, 2, and 1. And the correct answer for this is tachypnea. They're going to be breathing fast or rapid breathing. They're in pain. They're anxious. That is a sign of shock. Number 10, what is the correct position for a patient receiving a nasal gastric tube insertion? And so, as a patient care tech, you may not be the one who is inserting the tube, but as a nurse, I need you there helping me with that patient. So, when you're helping to assist the patient, are you going to A, put them in a supine position, B, in a semi-Fowler's position, C, Trendelenburg, or D, the prone position? I need your assistance. This patient's been vomiting. I have to put a nasal gastric tube down. That's a tube that goes from the nose down into the stomach. We're either doing that to connect it to suction, to remove secretions, or if the person's no longer vomiting, we can use the nasal gastric tube for enteral feeding, so we can connect the tube feeding to it. And yes, 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 we need this person sitting upright in a semi-Fowler's position anytime an NG tube is being inserted. Number 11, which of the following is a complication of immobility? A, hypotension, B, thrombosis, C, hyperactivity, or D, increased lung capacity? Complication of immobility. And yes, yes, and yes, it is B, thrombosis or blood clot formation. That is a complication of immobility. So that's why sometimes your patients will have those sequential compression devices, the ones that squeeze their legs if they're in the bed after surgery to circulate the blood, because stagnant blood will allow blood clots to form. So we try to get those patients up as soon as possible, walk them around. But if they do have their sequential compression devices ordered and they're in the bed, please make sure they're actually on the resident's legs or patient's legs so we can prevent the thrombosis from occurring. Question number 12. What is the proper method for measuring a patient's weight using a scale? A, ask the patient to stand on a scale with the shoes on. B, record the weight to the nearest 5 pounds. C, ensure the scale is on a flat, hard surface. D, measure the weight immediately after the person eats. And the answer is C. And here's the rationale. To obtain an accurate weight measurement, the scale must be on a flat, hard surface. You would not weigh anyone after they ate because that would add additional weight, pounds, especially from beverages. So usually the best weight is performed first thing in the morning, after the person has voided or urinated, and before they have anything to eat. So empty bladder, empty bowels, no food, that's the best weight each day. Question number 13, which of the following is a responsibility of a patient care technician or a PCT in regards to patient mobility? A, administering medications, B, assisting with ambulation, C, interpreting lab results, or D, performing diagnostic tests? Which of those has to deal with mobility? And if you chose B, you are correct. So ambulation, walking about, that's another term for ambulation, and that's how we help with our patients' mobility or movement. Number 14, what is the correct sequence for donning? With PPE, you're going to hear terms donning and doffing. With donning, O-N, you're putting PPE on. Doffing, D-O-F-F-I-N-G, O-F-F, you're taking PPE off. So let me reread this. What is the correct sequence for donning or putting on personal protective equipment? A, gloves, gowns, mask, goggles. B, goggles, mask, gown, gloves. C, gown, mask, goggles, gloves. Or D, mask, goggle, gown, gloves. Well, at least on most of these, they put gloves last. So usually your gloves are going to be put on last. So let's see what the correct response is. Is it B, C, or D? And if you chose C, you are correct. The correct sequence for donning PPE is gown, mask, goggles, and last would be your gloves. And that's one of our interns. That is Anaya or Anijah. And Anijah was with us for a few months, and we appreciate her assistance. All right, question number 15. Which of the following is an appropriate method for cleaning a patient's perineal area? So when you think of perineal, think of their private area. How do we clean it? Do we A, use the same washcloth for multiple patients? Well, that's just nasty. B, clean from the cleanest to dirtiest areas. C, apply lotion before cleaning. Or D, wipe back to front. Revealing the answer in 3, 2, and yes, it was B as in boy. Great job, team. When cleaning a patient's perineal or private area, it's important to clean from the cleanest to the dirtiest areas to prevent contamination, which is why we always wipe from front to back. We make the rectum the last area we wipe because the fecal matter, that is the more germier area. Question number 16. What is the purpose of a urinary catheter? A, to monitor urine output. B, to collect stool specimens. C, to administer medications. Or D, to measure blood pressure. Urinary catheter. Why would you as a patient care tech be inserting that flexible tube that sits into the base of the bladder? And if you said a urinary catheter is used to monitor urine output, you're absolutely correct. So we don't put catheters in patients for convenience. So if your patient's urinating on themselves and they don't have a bed sore or anything, we're not going to put a catheter in them because that increases their chance of an infection. I need my patient care tech, my CNA, to take that person to the bathroom more frequently. Now, a different scenario is we have somebody who is pre-op. They're about to go to surgery, and the anesthesia makes their organs go to sleep. We can't have this person retaining urine. So we would put a catheter in them. It's a medical reason at that point. So if we need to monitor their urine output to make sure they're not retaining urine or putting out too much, that's when we will get an order for a catheter. So if you got that correct, I'm really proud of you. Question 17, what is the most appropriate action if a patient falls while being assisted to the bathroom? A, leave the patient on the floor and call for help. B, help the patient back to bed immediately. C, document the incident and continue with other tasks. Or D, assess the patient for injuries and call for the nurse. I know this one's tricky. Revealing the answer in 3, 2, and 1. This one is D. If a patient falls, you want to, while you're waiting for that nurse to come because you've called for help, assess for injuries. You just don't want to leave them on the floor, like Ace said, because what if the person is bleeding? Are you not going to put on gloves and apply pressure? So you want to assess for injuries and call for the nurse. Do not try to get this person up off the floor by yourself. Whenever the nurse arrives, we would utilize a team approach to get that patient back into bed. Number 18, which of the following is a characteristic of a stage 3 pressure ulcer? So stage 1 is discoloration, just as a reminder. And stage 4 is when you get down into like the muscle. So for stage 3, is it A, the skin is intact with non-blanchable redness? B, partial thickness skin loss involving the epidermis and or the dermis. C, full thickness skin loss with visible fat. Or D, full thickness tissue loss with exposed bone, tendon, or muscle. Everybody, there's going to be a semi-disturbing image on the next screen. It's just the image of a pressure ulcer. So if you're sensitive, turn away now. But here we go, revealing it in 3, 2, and 1. So a stage 3 pressure ulcer, the answer is C. It involves Full thickness skin loss with visible fat. So stage 3 doesn't go down to the muscle and the bone. It stops before it gets that far. But you could see some of the subcutaneous and also a layer of fat. That's that white part. And just as a reminder, if you're interested in becoming certified as a patient care technician, you can go to floridacareeracademy.com, which is Florida Training Academy's online sister company. Again, you learn phlebotomy, you learn EKG, and you would have a national certification. And you don't have to come to Florida. You can take this course from anywhere within the United States. And that's me. All right, number 19. Which of the following is an appropriate technique for feeding a patient with dysphagia? DYS is pain. Phagia is swallowing, so either difficult or pain with swallowing. Do you A, offer large portions of food at once? B, encourage the patient to eat quickly? C, provide thickened liquids as recommended? Or D, offer foods with mixed textures? How do you help somebody who's having difficulty swallowing? Yes, yes, yes. The answer is C. Patients with dysphagia should be provided with thickened liquids as recommended to prevent aspiration. So once we notice this person's having problems swallowing, we immediately make them NPO, nothing by mouth. As a nurse, I'm going to contact the doctor who's going to order a speech therapist and a swallow evaluation. The speech therapist will determine the thickness of the liquids that this person can tolerate, whether it's honey thickened or nectar thickened. And then as the CNA, you add the thickener into the fluids so that it's the right consistency. And that way it'll be safe for the person to consume the fluids. And that's going to prevent aspiration or the food or fluid going into the lungs instead of into the stomach. Question 20. What is the appropriate technique for transporting a patient with a Foley catheter? Foley is a brand name, so I don't like calling them Foley catheters. They're indwelling catheters, the ones that's going to hang around for up to 30 days. All right, so is it A, keep the catheter bag above the level of the bladder? B, clamp the catheter tubing during transport? C, secure the catheter bag to the patient's leg? Or D, disconnect the catheter from the drainage tubing? You're moving somebody who has a drainage bag. What do you want to do? And I don't think that's the right answer. You do not want to keep it above the level of the bladder. So the answer is not A. You want to keep it below the level of the bladder. So this is a misprint, you all. The correct answer for this one is going to be C. And I'm just going to go back so you can see what C is. C is you want to secure the catheter up. I think there was a misprint, and I do apologize when I made this. It should be, A should say keep the catheter bag below the level of the bladder. And you do that so that the urine doesn't go back. It doesn't backflow into the urethra and cause a urinary tract infection. So number 20 was a mistake, and I apologize. Let's go to 21. Which of the following is a sign of fluid overload? Is it A, decreased urine output? B, abdominal swelling? C, dry mucous membranes? Or D, decreased heart rate? Fluid overload. Revealing the answer in 3, 2, and the correct answer is B. So if someone starts swelling, whether it's their legs, their stomach, that could be a sign of fluid overload. And the other signs include rapid weight gain, noticeable swelling, edema in the arms, legs, and face, swelling in the abdomen, cramping, headache, stomach bloating, shortness of breath. Sometimes they start having a wet lung sounds or crackles. Having too much fluid can also cause your patient to have high blood pressure and heart problems such as congestive heart failure, which is why some of your patients are going to have a sign or an order for a daily weight, because we need to know how much they weigh every day, because if they gain too much weight, they could be at risk of going into fluid overload. Question number 22. What is the appropriate technique for measuring a patient's blood glucose level? A, clean the finger with alcohol before puncturing. B, squeeze the finger firmly to obtain a large blood sample. C, apply the blood sample to the middle of the test strip. Or D, use the first drop of blood obtained. Revealing the answer in 3, 2, and here we go. The correct answer is A. The finger should be cleaned with alcohol before puncturing to reduce the risk of infection. And then after you clean the finger with alcohol for 10 seconds, you don't fan it, you don't blow on it, you allow the alcohol time to evaporate. Otherwise, if you go ahead and do the puncture or the finger stick, the alcohol can cause a little bit of a painful or a burning sensation. And you never want to use the first drop of blood. You want to wipe that one away because it could be contaminated with the alcohol. And let's go to our next one. Question 23. Which of the following is a symptom of dehydration? A, polyuria, B, hypertension, C, edema, or D, decreased skin turgor? A symptom of dehydration or lack of fluids. And if you chose D as in dog, you are correct. Decreased skin turgor is a symptom of dehydration. So if you pinch or pull the skin and it doesn't immediately go back down, if it just kind of tenses and stays up, that's a sign that the person has poor skin turgor and that they're also dehydrated. Question number 24. What is the proper method for applying anti-embolism stockings? A, roll the stockings down to the ankles. B, apply the stockings over socks. C, ensure the stockings are snug but not too tight. Or D, remove the stockings at bedtime. The proper method of applying anti-embolism stockings. We refer to those as TED hose in our facilities, but the correct answer is going to be C. Now, while we want the stockings to be tight, we don't want them too tight to where they cut off blood flow. So anti-embolism stockings should be snug, but not so tight to prevent constriction of the blood flow. We don't want to cut off circulation. 25. What is the purpose of a sitz bath? Is it A, to promote wound healing, B, to relieve constipation, C, to reduce inflammation, or D, to treat hypertension? And we rarely see orders for sitz baths nowadays, but I have an image on the next page to help you visualize what a sitz bath is. And the correct answer for this one is C. A sitz bath is used to reduce inflammation, especially in the perineal and anal areas. So imagine a mom who just delivered vaginally and she's really swollen down there. You would take a basin that fits into the toilet, fill it with comfortably warm water, and when she sits on the toilet, it's wide enough to where parts of her private area can get into the basin. And so that's going to help decrease the inflammation to that area. And so you all know how we end all of our classes. Thank you all for watching. This is Nurse Eunice with Florida Training Academy. And again, if you're interested in doing more with your CNA license, consider taking our online patient care tech course. Learn EKG, learn phlebotomy. And best of all, you can do it based on your schedule. So look, you're up in the middle of the night anyway, you might as well be earning a new certification. And so you all, I will be back on here, I think on Thursday. So I will see you then. Have a great evening and much success with your future exams. Bye, everybody.